So today we're here for, oh, and this is being recorded. Thank you for starting that recording, Bianca. This is going to be recorded today, so those folks that missed it can catch up with us through the recording. So if you have a problem with recording, feel free to keep your camera off and just observe. So today we're going to be into secondhand smoke, building equity and smoke-free housing enforcement. Next slide. So you're attending session 2. Before I say anything, if anyone didn't complete the evaluation before I give you any instruction, if you did not attend session 1 and you're attending session 2 for the first time and you have not done the evaluation, Bianca's going to put the evaluation link in the chat. This is a pre-post. So please don't do the pre if you've already done session 1 and didn't do the evaluation. You know how it works. So we're all public health folks and we got to prove what we're doing and study it and improve it. Okay. So thank you for that, Bianca. Let's get started in session 2. Next slide. So just a quick recap of what we did on our last training. We worked on our program goals and philosophy, which were building trust with communities, shifts from regulation to support, and we coming up with community-driven solutions. Some of the challenging barriers we discussed is that we have low capacity. We all face limited resources, both us and our housing providers. And we do know that there is a mistrust in authorities, especially after the last 4 to 5 years. And these issues are complex. These housing complaints are complex. We discussed the approach for housing providers. We talk about relationships over regulation. We want to work on tailored messaging. That one size fits all with our letters and templates doesn't always work. And then we always want to come from a harm reduction lens where we're assessing whether our policies are harming people. Do they have unintended consequences? Okay, that was last. That's what we should know. So let's get started on the new stuff. Goals for today. Next slide. So today we're going to practice the process, guys. We've learned the steps, and now we're going to practice what we're doing. We're going to come up with some innovative strategies today from you guys. I'm sure we will. We're also going to have collaborative opportunities. We're going to discuss cultural sensitivity in our breakout rooms, and then we're going to work on data collection and evaluation. So in today's agenda, I don't have our breaks in here because we're going to kind of wing it, but we're going to have at least one 10-minute break and a 20-minute lunch. If you would, please come back after the lunch. The last training we only had half of our folks come back after lunch. And I know we're all busy and we have things going on, but if you could just dedicate a little bit of time to this, I would appreciate it as best you can, feeling the way you do. So we're going to talk about the process, resident support, housing provider support, review the problem, talk about the solution, which is policy. We're going to introduce cessation opportunities, as then we're going to kind of talk about when the process doesn't work, introduction into session 3. Next slide. So here we go, multifamily housing complaint guidance document. So this guidance document is your sole resource that, that you're going to be using for this process. In the pre-evaluation, there were a little bit of confusion associated with what the expectation. Let me tell you guys, I'm telling you lots of stuff. This is not your expectation. The things that I'm telling you are recommendations, not requirements. So the only requirement you have in this from STEP, and I'll say it for Raya, but she's welcome to also chime in, not chime in, but comment, is that you respond to complaints. Now the responses is that word. It says respond to complaints. It doesn't say what you need to do response beyond the guidance document. So we're really going to dig into that guidance document today in our step 1, which is our initial preparation. Go ahead and go through these and then we'll go into a breakout room. Bianca, which step 1 is initial preparation. That's a hard word. Number 2 is we're going to engage the complainants. And then step 3 is we're going to contact the housing provider. Now, this is what we're going to get done today, steps 1, 2, and 3. Step 4, that's okay, Bianca, go ahead. Step 4 is what we do in next steps. And then 5 is our case closure and follow-up. So are you guys ready to get started? We're going to start our first breakout room. We're going to be joining our friends with, in the chat box, go ahead, Bianca, and launch the complaint guidance document as well as the interview guide.
Awesome.
Now,
okay, the guidance doc should be in there. I'll share the interview.
Okay, you guys want to get these links before you go into the breakout room, because these are your resources to use for your activity. So you want to download the interview guide and the resource document. So what you're going to do, folks, you're going to break out into 3 breakout rooms. I think there's like 4 people in a room. You don't have to have your camera on. If you feel bad, don't put it on. If you feel uncomfortable because everybody in your room's camera's off except for yours, feel free not to turn yours on as well. But this is an opportunity to engage with each other. So do what you can. So what we're going to do first thing is we're going to take the guidance document. Here, the guidance document. This is what we've come up as a template for your resource to respond to these complaints. What I want you to do, which is what we all should be at this point, because we did it in our first learning community call, we want you to develop a process. So here's your scenario. You've just been transferred to a new team at your public health department. They've received new funding to reply to secondhand smoke complaints within your community. Your team has been determined to be experts in process determination. So today you're going to develop a process to guide future employees to respond to secondhand smoke complaints using the guidance document supplied by your funder. This doesn't have to be extensive. This should be 3, 4, 5 steps. You don't have to go deep into it. It's just number 1, what's the first thing that you would do? Who would do it? Just a rough process. So does anyone have any questions before we break out into the rooms? This is not going to be super simple today, guys. We're doing some real work. It's going to take some thought process, but this is what we're doing in our work. So we want to practice it now. And the process is, you can't do anything else until you create your process. So with that being said, hopefully you've downloaded the documents and you understand the query. This is the first step in our workshop. So Bianca, if you would break out the teams, and I'll be popping in to talk to you to see how you're doing. Welcome back, everybody. I'm going to see your faces. Are you confused? You look good. You don't look too confused. It's good. Good. All right, recording's back on. Same announcement as before. Let's go ahead and just talk this through. We're going to talk about what you did, and this is basic, and because of time, we have to do it quickly. So this needs way more time than 10 minutes. I wouldn't expect anyone to develop a process or do this in 10 minutes. So let's go ahead and start with room 1. Who do we have from room 1?
That could be us. I don't know if I think
you are room 1. Yeah.
Yes, that's
okay.
right.
Perfect. Hazel, do you want to jump in?
Oh boy. Okay.
If you're a solid like no, please don't, I'm happy to support. But you were doing great. So if you want to jump in, you've got a lot of good things to say.
And let me just preface this, guys. There is no wrong way to do this because there's no best practice, really. This is new stuff. We're developing this as we go. So beyond just the basic instructions that I gave you, there's nothing else to develop. So there's no wrong answers. Let's just say that. In this, we're going to talk this through to make sure that we're all on the same page and moving in the same direction. So Hazel, do you want to just share out a little bit about your process and then your initial feelings or understanding from the complaint.
Okay, yeah, sure. So, excuse me. First things first, we make sure that it is a CCI complaint, or if it's a multi-unit housing complaint, because what I learned is that CCIA is protected by law, whereas multi-housing unit is not really. After that, we move on to contact the complainant and gather information. We dig in, whether it be looking at the property website to see if there's any documentation on it being a smoke-free, what their policies are. And then just have some background information. So when we go to the next step, which is contacting the housing management, we have an idea of what we're getting into, and just, gather as much information from the complainant. And then, like I said, the last step or the next step would be speaking to housing management. With this one though, Peggy, I wanted to bring up, Rhea encouraged me. Sometimes I've noticed in, especially in our department, is that the housing management people are not available, and they make it very, very difficult to just establish initial contact. So Rhea suggested I ask, what your suggestions are for those instances where, they're just out of office all the time. And even if you pop by or, try to call, they're not available.
Yeah, I have a good answer for that, because we have that issue a lot. Is most of the complaints say no contact with the housing provider, no contact with the housing provider. So first of all, looking for partners like GASP who might have that property listed on their website. If you have a rental registry in your health department, you can look at the rental registry to get additional information. Make sure you're contacting the individual that the complainant has on file to complain to, and send the letter, a receipt requested. So you can send the letter that's the post office makes you sign for the letter when you receive it. That way the health department has notification that you did receive the letter. And so Jefferson County did that. Donna did that. That was Donna's suggestion. And within hours after she received the delivery notice from the post office, she got a letter from the housing provider, notification from the housing provider. So that's accountability. So they know, okay, they're tracking this delivery, and they want to hear back from me. So that is a problem, Hazel. We do have the situation. But I love that you looked at the setting first, because setting is very important in your response, right? Even though there's no law, we know like the HUD buildings have a mandatory policy. So it's kind of like law. It's mandatory, not voluntary. So I'm going to do a little exercise here real quick. Guido, we're going to look at these 3 settings, if you will, please. And let's just kind of show the group some of the things you may be looking for. So upon initial research, you're looking here at Hotelville, Colorado. Go ahead and go to the website on this one. So it looks like a lodge, and it looks like, no, go back. Do the Vail Hotel in Pueblo, Colorado. That's it, right? Okay. So what can we tell? Now, the Vail Hotel this is public housing, but it doesn't really, look on amenities there. Not the lot, no, on the Vail. Yeah, go ahead and pull up the Vail, the one on the right, Guido. Yeah, go ahead and pull up their website. Okay, try
I'm sorry,
this one.
I was muted. I'm sorry, I was muted. Do you want to go ahead and try the Cathedral or the Guadalupe?
Yeah, try that one.
Okay. Yeah, we have the Cathedral Plaza.
Right. So as you can see here, Cathedral Plaza is part of Catholic Charities, and Catholic Charities has, it says right there, affordable, subsidized. So so you'll know by research, you'll get more by researching. And you can also look at look down and you can look at their amenities that they have. Perfect.
Correct. That's our interpretation.
Okay, so you may not get a ton. Okay, Guido, that's fine. Thank you. You may not get a ton from a simple website, a Google search, but you can get a lot about the image. Like that building we saw is a very tall, squared building, and it looks old and aged. It looks like it would be very difficult to have a designated smoking area there. There are things that you can gather just by looking at the image of the property itself. So make sure that we're Googling these images, but not relying solely on the images to create our understanding of what's going on in the situation. Now, I did pop in and give you guys your property as well as your complaint. Hazel, we're going to come back to you on what happened during the interview process. For now, let's get through everyone's kind of processes to see if someone came up with any process that may be a little bit different. Thank you, Hazel. Room 2, Jessica and your team.
Lucy, do you feel comfortable? I don't know.
Yes, that's fine.
Okay.
So I wrote down a couple things that we said. Since I don't really do multi-unit housing, I was really listening in on what they kind of already do. So we said, like always, we'll just take in the complaint. And usually that would go to like the people on the team, whoever that is on the team. We didn't really clarify who that was, but we would take the complaint, and then since all 3 of us would see it, we would designate one of us to take care of it. And then from the team, that person would kind of like investigate like what policies are in place, if they see any visual policies that they know like that are visual to just public in general, because that's very important, I think, before you answer any questions or you go asking any questions. That way it doesn't create any more questions. So we would probably do like a quick scan of the property or online, whatever policies they have in place, or what kind of like if it was a multi-unit housing HUD, or because we know they have specific differences. Then we would reach out and see what was really the issue. Is it an ongoing issue? Have they complained before? Have they talked to management before? Like, have they took the initial steps, and are we like the next step to providing assistance for that? Then we have the conversations. So in our instance, like that, it was the management, right? They're not really tenants of the building. So does anything in their handbook say that they're not allowed, since it's a HUD housing, I believe it was? If any of those rules apply to them as not being residents. But since it was a HUD housing, like they obviously have to comply with everything that's already in order, because it's a smoke-free campus, like in general, all the way through. And then is the complaint because even though they were outside, were they close to like 25 feet to like an entrance? How is it affecting people with them being outside still? Because they did say that they do it outside. So they're obviously not doing it inside. But like I said, they may not be aware of the 25 feet rule or anything like that. And then just obviously us like making sure the signage is there, and kind of like going through the whole process, like of what's visually there and what's in their policy. That's kind of where we got to.
Perfect.
We had
So
other conversations, but I did not write them down.
That's okay, Lucy. I put the complaint in the chat box, and the issue with this one is, if you can see in the very beginning of it, the senior manager smokes 4 to 5 cigarettes a day at work and outside. So this is a common issue of a staff problem, or even maintenance workers, folks who are contractors who visit the property. Everyone should be acknowledged that the smoke-free policy affects everyone, visitors and guests. And this would be a conversation that you would want to have with the property manager, because senior management doing it, then it's going to really set the tone for the whole property. So we're going to really dig into this when we go into housing providers conversations, like what kind of conversation are you going to have with this individual about this issue, right? So thank you, room 2, for sharing that out with us. Room 3, Devin, would you and your team like to jump on and maybe share? And I'm going to just put a plug here, Alberto. You're still on. If you would do me a favor and get your process that Boulder has for responding to complaints, and at the end, after all 4 room shares, I would love it if you would just share the finished product so they know kind of what we're talking about. Appreciate you. Bianca, you'll need to screen, won't he? Yeah, we'll see.
He should be able to, but if
Yeah,
not,
he
we
should
can
be able
give
to.
him the right
Okay.
administration.
Okay, we still need lockdown security measures here. Okay, so we're on room 3.
3.
No, at least, yeah, 3. Okay, Devin.
Yeah. And this is for part 1 and part 2, like developing the process.
Just do part
and
1 for
the complaint?
now.
Okay.
Yeah, do part 1 for now.
Okay. Well, for part 1, just really defining what the process looks like, and there was a lot of emphasis on just learning more about the situation. So like these interview questions are great for that. Just understanding what conversations have already happened, what hasn't happened yet. Like if it's a resident, have they spoken to their neighbor? Have they spoken to their manager? Just trying to get more context for what has already happened to help inform our decisions. And then benefit of going on site and visiting the location is that you can kind of see what is actually happening day to day, what it looks like, because it's like if they have a smoke-free policy but it's not being enforced and you see signs of smoking like cigarette butts everywhere, then that can help us decide, oh, maybe we need to talk to the manager about resources or best practices for enforcing it, or maybe it's providing more ashtrays or something for them to dispose of them so it's not on the sidewalks and stuff. Anyway, just getting more context from the conversations, the setting, the location can help inform what is the best fit for that situation that we bring to the conversation.
That's perfect, Devin. So what Devin is alluding to is an environmental scan of the property. When you go to visit, and you don't have to be visiting the property to be responding to the complaint. You can visit a property just by, hey, we're public health department. How are you guys doing? Can we, is there anything we wanted to meet you, blah, blah, blah. That will give you an impression of the property. Like Devin says, do an environmental scan outside, walk around. Don't walk around with a notebook taking notes like a public health department, though, guys. Walk around and get your understandings visually. Don't be taking notes and with a clipboard like you're some regulator, because we're not. But if you do see, like I went to a property in Boulder, I was doing it for Alberto, and it was so much cigarette litter. I took pictures of it because I needed that for the case as well. So to Devin's part, that environmental scan will give you very, very much information. So visiting the property, you can't beat visiting the property. It's community engagement, and it's definitely part of the success of this program. So let's go ahead and go to room 4, and I want to listen to the newbies in the group share what their perception of the process is going to be. And then we'll have Alberto show his finished product, which is really where we want to be to make our program sustainable for the next folks that join us. Because we're all so smart, we get promoted so often, we need to have someone, take over for us. They need to know what we're doing. So room 4, would you guys share the process that you discussed for responding to secondhand smoke complaints? That would be Alberto, Who was else?
Let me turn
Alberto.
off my mic or turn,
Okay.
yeah, my mic was on.
That's good.
Yeah, so we followed the list, which is very helpful, which we did not talk about going and actually going to the property. That is something that would be beneficial. And we kind of just followed that and the questions we would ask. Some of the things that were brought up is make sure to see if the complainant wants to be confidential or if it's okay if their name is out there. So that was one that it's not on the list, but we need to make sure that is a question. And also, you know, we were talking about not offering too much services, you know, of help. Resources, yes, but not, you know, you can't find them new housing, or so just don't put yourself out there too much and something that's going to come back and maybe haunt you. But what we can do is find resources through GASP or calling you, Peggy, for some help, and offering legal, like the federal level requirements, because the legal language, because that would be something I sure wouldn't know anything about. So, and also, yeah, finding if they're a public or private, and how those rules apply, or some of the different things that we talked about in our work group.
Perfect,
And yeah,
Aileen.
Okay.
Were you more confused after, or did you get any clarity from the process?
What would confuse me is the public private HUD. It'd be nice to have, and you probably already have it, you know, if I had to go look, say, oh, what, so it's private, so what does that mean? Or if it's public, what does that mean? For me, I would be searching frantically.
That's a really good question. And the easiest way to find out if the property is, because I hear you saying public and private, and I want to make sure that folks aren't confused by that. So we're talking about public housing is a setting. That's the entry level of housing by HUD. That's the only demographic that's covered by a mandatory smoke-free policy. Very small portion of our housing demographic, but they are the ones that we look to because they're the ones that have been smoke-free for the longest since 2018. So that's public housing. But when you talk about private and public, that is, we're going to use the term multifamily housing and single family housing. So if you go on and you research the address and it comes up on Zillow or Trulia, it's a owned property, right? So that's where we get confusing because we go into those multifamily properties, but they're owned by, and they're managed by an HOA. So we move into a whole nother category, and we're not even going to touch that because we have a whole special training on that next year because HOAs are a whole different category. But if you Google the address on the complaint and it comes up on Zillow, it probably is privately owned. And as we know, the Colorado Clean Door Act we don't do any regulation on privately owned properties. We are moving into regulating privately owned through HOAs, shared properties, but we're not there yet. So that was a good observation. I do want, Alberto, were you able to pull up that process you guys have?
I also want to mention that most of the places that have to be under the HUD rule, which requires them, for instance, to have a 25-foot perimeter for smoking around all their buildings, are usually managed by what we call a public housing authority. So that might be another way to figure out whether they're public housing or not. There are a few others that are subcontracted as well, but most of them are under public housing authorities.
Perfect. Thank you, Pete, for that additional information. That's great. Alberto, do you want to walk the folks through this? This is a Boulder's process. This is institutionalized in their documents, and this is what they do to follow. So this is, if you do nothing else this year, this is what you need to create. So Alberto, walk us through this.
Sure. So it's a very basic walkthrough. So the goal is to have a document like this so that anyone who steps into this work can at least have a baseline understanding of some of the nuances and the steps that they can do. So the first thing, of course, is we receive a complaint either through our local complaint form, which is called WUFU, or we also get a forwarded from Raya at the state. The first thing that we do before we take any actions is make sure that we log it. We have a spreadsheet that we organize by fiscal year to keep track of all the cases that are open, the cases that are closed, those that are ongoing. And the way that we organize it is in a way that you can tell a story. You can easily understand what was said, what was done, when it was done, and where. So all of that is in this Excel spreadsheet that we keep shared amongst the tech team. So the first question that we ask ourselves is the setting. So is it in housing? Is it in a workplace or business? Is it in an outdoor public space? So based on that, then we determine what are the other steps. So we usually, is this under the protection of CCIA? Is it a business? Then yes. If it's a private housing unit, be it private apartments or a single family home, then what are the options? If not, is this a public multi-unit housing? Do they receive any sort of federal, state, or local funding for housing affordability? Then based on those decisions, or if it's an open space, then we follow other different things. Who do we communicate? So this is an idea in general of what to do. Some of the first things that we do is we contact the complainant to get additional information to make sure that they've been heard. We try to do this within 7 business days from the time that we received it. We log it and we provide them. We also use our interview document process. And we can offer to share resources. We can offer to contact management on their behalf. We can do so with anonymity, my bad. And we follow all these different steps. Of course, there's always going to be nuances based on each case. So sometimes Peggy and Raya have been super helpful with addressing certain things. There's been instances where us at the local level have run out of options because as public health entities, we also have limitations. So we have to draw a line with complainants and say, well, these are the options that we can provide. Unfortunately, some of the things that you may be requesting or some of the things that you may need outside of our purview, and we're going to do our best to give you the resources that we have. And sometimes what we've done in previous cases with Raya and Peggy is we elevate the case to see what other options they could achieve through some state support. After all that, we also have some things. We talk about the different ways in how local policies supersede each other. So we have state, local, and organizational. We usually encourage local policies or businesses to have stricter rules than that of the baseline state policies, which is the Colorado Clean Indoor Air Act. And so we often, as part of the research process, the interview process, we examine and ask, and like we did in room 4, we ask what type of policies are there? Does the complainant know about these policies? Are there any rights that they're entitled to beyond the CCIA rights? So at the county level, we also have other options such as mediation. One of our cities provides countywide services for mediation, which is sometimes very helpful when there's a power dynamic between tenants and property management, or between tenants and landlords, or sometimes between 2 tenants. And so it's always good to have that buffer person to provide, and we give that resource, and I believe that it's free of charge. So we also have different stipulations for violations that fall under CCIA versus those that have smoke-free rules, multi-unit housing that are private. We also, in this process, we have some templates as to what to do in each of those instances, how anyone can respond to that, what are some of the things that you should address as part of that email. And even in some cases, you might receive a complaint from the local bus or any sort of public transit. So we've had to do some research on that as well, because that is a third-party compliance that is not within governments per se, that is under RTD, which is in the Denver metro area. And additional to that, we keep links and phone numbers and other things as to what to do in the written process. What are some of the contacts? What are some of the things to keep in mind when you do a site visit? What are some of the things that you look at when you look into a business? Potential next steps, how to ensure your personal safety, how to communicate with your teammates. We've been doing this for a while, so definitely we've had some time to process, and it's always an evolving document where we sometimes learn new things every year. So don't be afraid to start drafting this and processing that and reflecting that with your teams, because it's going to take some time and it's never going to be perfect, and that's totally okay. And I'm also happy to answer any questions that you may have. It's a big document, so I also think I know that it might be a little overwhelming.
Thank you, Alberto. That is perfect. I want to invite all of you to reach out, peer-to-peer mentoring, reach out to, I'm going to offer Alberto services. But if you don't have this process, now he said it, right? We've been doing this for a while. And that's what I said earlier. Your process might start with 5 steps and it may end up to be like Alberto's, because he's writing down and learning and reporting and making adjustments through evaluations through his process. So he's always refining and improving it based on what works and what doesn't work, facilitators and barriers. So your initial process is not going to look like the same process 5 years from now or even a year from now, because you're going to learn from each complaint that you respond to more things that may be missing. So make sure you're documenting it all. Alberto, thank you. Whoever takes over your position in the future is going to be well suited to do the work. And I appreciate that for our program alone. I just want to ask a couple of questions. I'm going to give you guys an opportunity to ask Alberto any questions. And then I want to just open up the floor about the interview guide. How did you feel asking the questions? Was there any questions on there you felt shouldn't be there? Or give me your initial feelings. We're going to take about 3 minutes for this, and then we're going to take a bathroom break for 10 minutes. So does anyone have questions for Alberto, or could someone just share what you thought if you did the interview guide for the first time, what you thought about it?
It looks like we do have a question in the chat. Jessica asked Alberto if he would be willing to share this so they could use it as a guide to create their own.
If you would like to if you would like to email, yeah, thank you. Thank you, Alberto. If you want to forward it to me, just let me know. Or you can email Alberto and he can send it straight to you, and then he can help you through it. But yeah, so there should be about 5. Go ahead. What?
I was just going to say that I'm happy to forward it to Peggy, so then you can do an email blast. The Perfect. One thing though is that there's going to be links and file pathways that are not going to be applicable to your case. So it's just an example as to how we communicate with each other. The goal of this document in general is that if you were to just start today and you had nothing but this document, how confident would you be with learning the ins and outs of the secondhand smoking process? So we try to be as thorough as possible. So I'm happy to answer any questions once we get to gander at the document.
Thank you, Alberto. I'll be happy to share that out. And just to give you guys a heads up, these process documents are uniquely situated to fit your public health department. And let me explain why. When Alberto first started, he knew none of this. And we started walking through, and I sent him another health department's template letter. And they were like, oh, I don't think this is the tone of Boulder. Because it was more strict, right? It was more authoritarian regulation. And so they did their own templates based on the value system of the local public health department, because it's for Boulder residents. So you can't take a Denver document for Boulder's residents because they're different. So make sure that you are adapting these documents and these processes to fit your community and your needs. Did anyone go through the interview guide for the first time that wants to share your fears or your trepidation about asking these questions? Okay, guys, hearing none, I'm going to, we're going to break for Bianca. Let's go ahead. It's 10, let's say 10:55. Let's come back at 11:55 and let's see where we go from there. Okay, guys?
11:05.
Just
11:05.
I'm sorry.
Yeah, 11:05, right? Not 55. You're gonna give them an hour.
Thank you.
You're
Yeah,
welcome.
my numbers weren't I wasn't mathing right there, was I? Okay, so we'll see you on 10 minutes. Go get a snack, fresh cup of coffee, and bathroom or whatever you want to do. I'll see you at 11:05. My camera wasn't working when I came back, so I did the OIT solution. Turn it off and turn it back on again. So we're working.
I learned that if I put my earbuds in and then sit in my chair, that
Ooh,
there's
could y'all
static
hear me?
electricity. Yeah. Can you hear me?
Yeah, I was talking without my headphone on.
Oh, we could hear
I was
you.
like, why can't I hear anybody? It's the simple stuff that gets me every time.
Can you hear us, Peggy?
I can now, yeah.
Okay.
Yeah. Did we have Bianca come back? Yeah, there she is. Hi. Hello,
Yeah,
Miss
I'm on.
Engineer.
Hello.
All right, well, let's go ahead and pick up our presentation where we left off. I believe we're on slide 22, Bianca. Okay, go ahead and advance. So in your breakout rooms, you were each given a complaint. Your complaint is going to be in a public housing setting or a permanent supportive housing setting. So all the complaints you received, the folks that are complaining should have a policy in place. These are some of the questions we find from the complaints that we receive. The residents most often ask are, what can I do to protect the health of my kids? And I complained, but nothing has happened. This is important, right? This happens a lot. My building does not have a smoke-free policy. What should I do? My building has a policy, but people still smoke inside. And I live in a HUD building. Shouldn't it be smoke-free? And then I'm afraid of retaliation if I speak up. So for the very last one, the retaliation piece, it is important to be very honest with your complainants when they complain. And if they do want to be anonymous, because in the very beginning, we asked them, is it okay if I speak on your behalf with the housing provider about the situation? And if they say no, I'm terrified of him, her, they might come against me. They've already told me several times that I'm not allowed to complain anymore. So it's really important that we learn, and we're going to learn this in session 3, which is going up into some legals, is what happens if a housing provider retaliates against a resident for them complaining. Those are some things we're going to learn about the warranty of habitability, which protects against retaliation from landlords to tenants. And then the rest, the HUD building, it should be smoke-free. So then you want to determine, why does the individual not think her HUD building is smoke-free? The good thing about a HUD building is they have funding attached to the expectation that they have a smoke-free policy. So this is a really great demographic to respond to, because yes, it should be smoke-free, And there's also higher level of management like HUD that we can go to have them help us. And we're also going to learn about reasonable accommodations for individuals who want to submit a complaint in session 3. So that work's going to be given by our mediators and our attorneys and not by me. So that'll be really interesting information. But the one thing is, like, I complained that nothing's happening. That happens a lot. And there are some legal requirements that Annie, our attorney, is going to share with you about what are housing providers required to share with individuals who complain. What is the timing required for them to respond to individuals who complain? What methods housing providers, what methods are they required to respond to the resident about the complaint? So we'll go into more of that about in the session 3. Go ahead to the next slide. So what kind of supports can we offer our residents? And this is really important that you put this in your process, because this is going to be based on your capacity of your team. What can we do? I love that Alberto put in his process a timeline as well. So when should this happen? He has a 7-day timeline for response. That may be unreasonable for someone who has very little capacity. It may be a 30-day response, but make sure you have that timeline in there, and as well as the roles. So some of the supports you might consider offering to residents, the first of all is this complaint process where we did the telephone call or you do a Zoom meeting with them. I like to do a Zoom meeting because it's kind of like in person, but you want to make sure they have the technology to be able to handle a meeting like that. But this gives them the opportunity to be heard and understood. They want, honestly, everyone I call says, "Oh my God, thank you for contacting me. I can't believe someone's actually calling me." So they're very surprised about the response and very thrilled that someone is interested in offering them support. So they get an opportunity to be heard and understood. And next. So you want to educate them about the options. This is the hard line, guys. This is where, you have to be really honest. We talked about that trust model in the session 1. We want to make sure we're being honest about what the realities are, right? Our inability to make a housing provider perform, right? We can't force a housing provider to enforce their policies. Even if they're HUD, we can't force them. We can ask them and we can help them and support them to do it, but we can't make them. So your complainant needs to understand what their options are, and they need to be educated that the Clean Indoor Air Act does not support their indoor environment. Their unit, their home is not protected under the Clean Indoor Act. That's the most important thing you can translate. And next. So you want to advise how to communicate with owner or manager. You may have an individual who's really at the risk of being evicted themselves because they become harassing from their complaints. They complain over and over. I have one housing provider said, "There's an email from her every morning in my inbox." This gets ignored. This is too much. So what we do is we communicate with them. Let's set you up on a smoking log, maybe, that you write this stuff down and you only communicate with the housing provider once a week or once a month, or, so we help that resident complain in an effectual manner and not to be harassing. Next. So support them resolving their situation. That might mean, actually, a lot of times talking someone into finding a new home. So if they don't own it and it's not public housing where it's very limited and it's market rate or affordable housing, they might just want to move. So sometimes it's like moving can be the best option. It always is the fastest option. But again, you don't know what you're getting into when you move to a new property. So maybe supporting them with a mutual rescission where they can get out of their lease and move without punishments is something that you might want to do. And next. And then finally connecting with their owner or manager to educate and assist. Like that complaint in Cathedral Plaza where the manager was smoking. They may not think that's against the smoke-free policy, but we want to make sure that we're educating the manager that the expectation applies not only to the residents, but to the staff, contractors, and visitors and guests as well. Next. So here's some baseline recommendations that you can give to residents. Keeps it simple. You want to have them keep a log of when and where they smell the smoke. This keeps them from over communicating with their housing providers, over complaining, but they can actually have this log of when and where they smell it. And 2, so get a letter from the doctor, especially if there are health issues. We have a template letter for a doctor to fill out about secondhand smoke. Of course, the doctor's not going to say secondhand smoke is causing the issue, but they definitely will tell you that it exacerbates the issue. So in other words, it makes it worse. You may have people with COPD, asthma, environmental health, toxin sensitivity, people who are more sensitive to secondhand smoke toxins than others. You want to make sure they get a letter to support that condition from their doctor. And 3, so you can send a letter to the manager or the management company. You can help them write a letter. You can send them the template for reasonable accommodation. You can give them sample letters. You can review their letters for them and give them maybe, we had one that came in and it was so like, I want you to do this now. And we were like, oh, maybe let's soften this up a little bit and talk about the health effects, So you can help them communicate with their manager and management company a little bit better to get their point across. 4, and then making sure they keep a record of all communications. You guys, some of these people come to these complaints like they're a lawyer in court. Seriously, they come with, just stacks and stacks of documents. So we do want them to record all their communications, but to an extent, some people make this their profession. Honestly, if you Alberto has one in Boulder that literally, I do think sometimes they get a little bit of enjoyment from the activity of the complaint. It's almost like they are working in public health, right? They're like trying to fix the situation for the whole community. And so it's important that we put them in the right mindset of, let's talk about how it's affecting you, and let's talk about what we can do for you. And then let's make sure we're keeping all communications in a file. So when we need them, we can say, yeah, you've communicated with your housing provider 10 times. Here's your proof of that. Next slide. Oh, I'm sorry. And if all else fails, we do have also a template letter to contact your city council or your elected leaders. So when it gets very down to the end of the road, I hate to have a person leave with no next step. So I always like to be a next step. So at the end, the next step would be, perhaps you could reach out to your city council and let them know the story. We have a sample letter from that. We collected it from online. It's not anything I created, but I'm happy to share that with you. But it kind of says, this path is over. Now let's go over here. And the reason you want to do that, and I'm going to tell you what will happen. They'll share their story with their city council, and then the city council will email the public health department, and your leader will send you an email from city council saying this person has a smoking complaint. So you're like, we know, we sent them to you. So basically what you're trying to do is say, we can't, and that's your opportunity, right? Right back to city council and say, we would love to help this individual. Unfortunately, the law doesn't cover blah, blah, blah. There's your advocacy. So it doesn't have to end at, sorry, we can't help you. Next slide. Does anyone have any questions about the resident support or anything that we covered so far before we move into housing provider support? Okay. Let's go into housing provider support. So what do housing providers ask? They ask totally different questions. Is it legal to adopt a policy about smoking? How would I enforce a smoke-free policy? Can I do anything about marijuana smoke? Oh, let's go back to this slide just for a minute. So when we're asked these questions, especially, can I do anything about marijuana smoke? These are pretty much open-ended questions, so there's no definitive answer to these, but these are where you would direct your support. So obviously, if a housing provider is saying, how would I even enforce this policy? That's where we step in and we go, well, we have a recommended enforcement strategy for you. Would you like to hear about it? How are you currently enforcing your policy? Well, we use 3 steps. Well, let me share with you our understanding about adding more steps and doing a slower process to your enforcement strategy. We suggest 5 steps, and then explain why you would suggest 5 steps. So it's important that you understand what they're doing, and then you help them to improve on that enforcement strategy. Okay, Bianca, next slide. So what is the role of investigation? First of all, investigation is the wrong word. Until we turn this work over to public health investigations, I think we're just doing just research, but this is what we're going to call it. Okay. So what are we doing there? Why are we even looking into this when there's nothing, when we feel like there's nothing we can do about it? First of all, it leads to policy adoption. So without failure and if this was working without policy, then everything would be great. But it's not. Clearly, it's not, because we continue to get complaints, and complaints that really kind of roll around the exact same thing, right? And we're helpless. We just can't make anyone do anything because there's no policy, there's no guidance. So the role of investigation is actually to collect our failures, to talk about how we do need policy for us to be successful. And then role 2. So we want to expand existing policies. So I'll give you an example. You may have a building that has a smoke-free policy, and the complainant says, we have a smoke-free policy, and they send you the policy, and you find out, well, the individual said that the resident was smoking on their patio and the smoke was coming in their bedroom window. And then you look at the policy and you see, guess what? Patios are excluded from their policy. They're smoke-free, but they haven't included their policy. So this is an example of expanding the existing policy, where then you would have that conversation with the housing provider and say, we have a complaint from an individual who's been exposed to secondhand smoke from the patio. Does your policy include patios? They'll say no. And they're like, that's where you have the conversation. We're like, well, we do find blah, blah, blah. So this is where you're now advocating for them to expand their existing policies to include patios. And row 3 is the most important, is cessation opportunities for the resident. So we may not be able to reach the smoker with the cessation resources ourselves, but we want to make sure we're supporting the housing provider to be able to provide these resources for the residents. And then we're going to also work on that. What resources are we offering? I wanted to show this real quick. The investigation. I see if I can see this. See if y'all can see this better. So anyway, probably not. No. Yeah. Okay, this is a folder. The folder has a really nice image of a cityscape, because this is from Denver. This is their folder that they had made up. So the folder has the contact information on the back. It has the tobacco prevention, education, cessation. So this is the folder I usually show up to when I'm doing a meeting with a housing provider. It's just a little thing. It'll have in here the letter that you sent to them about the smoking complaint. This is the Clean Indoor Act quick tips, business card, and perhaps signage. This is a little sticker, a no smoking sticker. But these are the things you want to show up to the property with, and then you'll leave this with the housing provider, just to have something to kind of engage them with. But these folders are really nice. You can use these for your Clean Indoor Act complaints as well as your housing complaints, and you can make it unique to your community, as Denver has theirs. Next slide, please. So what are some baseline recommendations for the housing providers? These are very important because this is going to make them successful, or not? Is it going to improve the situation or not? The first thing you want to do is, just like us, you want to know who's enforcing this policy. So you want to help them with roles and responsibilities and make sure that they understand whose role is it to enforce this policy. And two, always support cessation. Why do we support cessation? I can tell you why. Because a smoker who learns to smoke outside may smoke inside when the weather is not good. A smoker who quits will never smoke inside again. So keep that in mind. The best thing we can do is to help them quit. It's not required, but we want to make sure they have the resources that they need. And three, so record all activities. We want to help the housing provider understand how to report and record their activities by using our 5 steps and the suggestions around that. But we want to make sure that they have a process, right? Like if someone gets a complaint, I'm a smoker and I'm smoking in my unit, someone complains about me smoking, and they come and knock on the door and they say, Peggy, someone's complaining about your smoke. And okay, that's a knock and talk, right? That's the first step of our 5-step process. So they want to record this down as we discussed, but we want to make sure that they understand what steps are happening at each step, and that they also have an agreement or understanding of when would that second complaint trigger step 2. So there's a lot more that goes into the housing provider's process, just like our process. The more detailed our process is, the better we are at our work. The more detailed their process, the better they are at their work. So our job is to support them through creating a process that's equitable and effective. 4, so ongoing staff and resident communication, guys, this is where we're talking about making those relationships with our housing providers. We don't want to just show up when there's complaints. We want to find ways to be there with them. And I encourage you to look at your health department and find out what's going on. Who's our community engagement staff? What's happening? Who's doing outreach in our community? Who can we engage on other teams that might help us with this communication and relationship building with our housing providers? Because we're not going to expect to go into a housing provider setting and be the experts and tell them exactly what to do, because that's not going to work. We need to ask them what they're doing, and then we need to say, hey, would you like some suggestions? We have had success with this, and then give them the spiel or the advocacy moment. But make sure there's a relationship there before we start talking about, it's like going through someone's closet that you don't know and saying, I'd throw that out. I would throw that out. I would keep that. You don't know them yet. You don't know how to clean up their closet. We also don't know how to organize their process without knowing more about it. And is there a 5? That's it. All right. Thank you, Bianca. So this is how we do it. We're going to educate the housing provider. This is, again, a capacity drain, right? So the public health departments that are actually doing this now, educating housing providers, those are the folks that have signed on to do strategy 2.1, and they're doing that in their implementation plan to educate the housing providers. Now, I'm going to tell you, if you don't have the capacity, but this needs to be done. Let's say you respond to a complaint, you're talking to the housing provider, and they said, yeah, we don't have a process. We would love to know more. Yes, we would love our staff to be trained. And then you're like, oh, great. Now I got to do a housing provider training, and I have no clue. This is where you come to Raya and myself, because we are an extended arm of your public health department. We're there to fill in the gaps where capacity may be missing. So if you have a housing provider that requests a training and you don't know what to put in it, you don't have time for it, I want you to reach out to us. I don't want us to be saying no to educating our housing providers. So make sure that this is a priority and that we can get this done, whether it has to be done through give them a recording or however we want to make sure that we are accomplishing this goal. Next slide, Bianca. So why is this now becoming more important? As we discussed in session 1, the Surgeon General's report, which was very enlightening to our process, which says multifamily housing has been named as a key setting for smoke-free laws and policies. So this setting is really ripe for policies that will lead to support smoke-free housing. And this could be national policies, state policies, or the very best ones, which are local ordinances or policies, because those cannot be taken away from you once they're established. So local policies are great. Next slide. This is a little cutout from the Surgeon General reports. The evidence is sufficient to infer that comprehensive smoke-free laws that apply to all indoor areas of public places and workplaces, including casinos, as well as smoke-free policies for multi-unit housing, would reduce disparities in smoke-free protections and reduce exposure to secondhand tobacco smoke if fully and equitably adopted, implemented, and enforced. So that's what we're trying to do here, guys. We're trying to fully and equitably adopt and implement policies that are enforced regularly and consistently. It's a big ask, but I think we're on the road to success with this one. Next slide. So what is the problem? Next slide. Here we go, guys. An attorney of mine did an article and said, there's a statement that says, one of the laws says, quiet enjoyment of the home. I'm getting myself a water. Quiet enjoyment of the home means two different things to two different people. If I am a smoker, people who do smoke, residential smoking bans are the last frontier in the fight to take away rights from smokers. So let's say my quiet enjoyment of my home is settling down for the 6 o'clock news in my lazy boy with my drink and my cigarette for the night. That's my quiet enjoyment of my home. Now, you have non-smokers who say this is one of the last areas that are unprotected and remains a constant source of secondhand smoke. So while I'm over here enjoying my cigarette and my drink and my quiet enjoyment in my home, my cigarette is drifting into the individual next door who is not enjoying their quiet enjoyment of their home. So this is why this makes sense. It's two different perspectives from a smoker and a non-smoker. And remember that this non-smoking in the house, before the Clean Indoor Act, before smoking wasn't prohibited in public places like movie theaters, workspaces, people used to leave their home in the morning and they would go to work and they would just smoke all day at work. And then they came home and they didn't smoke anymore. So now that we have these protections in the public places and businesses and workspaces, folks now are like, their spaces where they can consume tobacco is limited. So that's why we see this smoking inside the homes spike so much, is because really it's kind of the last place where they can consume their tobacco products, and we're trying to take that away. But we don't want them to. They don't have to quit. They just can't smoke indoors for protections of others. If they could contain that smoke, they could smoke anywhere they want, but they can't. Next slide, please. Again, we're not just talking about a nuisance. This isn't just a smell that bothers me. This is a smell that is bad for your health. Make sure you use this image when talking to housing providers or training them, and you talk about the real poison, batteries, petrol fumes, toilet cleaner, candle wax. These are all in the secondhand smoke toxins, and this is what's causing the issue. Next slide, please. Okay, just recap on what secondhand smoke is to make sure that housing providers understand that it's not just a nuisance. It's not just an uncomfortable smell. Next slide. So the Surgeon General says there's no safe level for anyone anywhere. There's no safe level. That's definite. Next. We know that secondhand smoke causes heart attacks, stroke, asthma, cancer. We know that outdoor exposure can equal indoor exposure. So if you walk by someone and you're smelling their tobacco smoke, you're being affected by the toxins. We know that multifamily housing adds an additional risk of exposure. And every 11 minutes, someone dies from secondhand smoke exposure. Less than 4,100 a year die from cardiovascular disease and lung cancer. More people die from secondhand smoke than car crashes and gun deaths. What are some other concerns? Third-hand smoke. Fun, third-hand smoke. Don't forget about this one, because as science is developing, we're learning that third-hand smoke is more dangerous than secondhand smoke because of the synergetic effect it has with air and other toxins. So what is it? If you ever like toured an old like house for sale and the pictures have been taken off the walls and you see like white spots and then yellow, that house has been smoked in. It is particles that settle on all the surfaces. The issue is that the particles continue to react and they off-gas, and that creates these volatile organic chemicals that kind of float in the air. So like I said, the secondhand smoke combines with the air and makes a whole new toxin and gas. We know that it contains nicotine and other toxins as well as the ones we mentioned. And then nicotine, again, is just very reactive with other particles. There's some great studies on secondhand smoke. The secondhand smoke theater study is excellent. And I can send that out to you if you'd like to review that. Let's do next slide. Don't forget about vaping. Vaping is included in all policies because we know it's not just vapor. It's an aerosolized mix of chemicals, some toxic. Next. So the devices that are used for vaping, we know are often unregulated and they range in quality. Also, they range in content. Next. A National Jewish study on aerosol and vaping says it causes pulmonary cell damage, especially in the young. And it can be used to conceal other substances. So let's say you're in a public housing setting and federal law does not approve of marijuana in public housing because it's federally funded. Marijuana has not been made is not federally approved yet. So it could contain marijuana or other substances that may be even more dangerous. Is there anything else on this, Bianca? And we know, everyone knows, youth are using at increasing alarming rates. And let me tell you one thing about youth using at alarming rates is this is social norming. If you have a building, I worked in a building that had single family home. So it was a single mother or single father raising their children. And they had a smoke-free policy, but it was horrible. No one regarded it. It was largely ignored. And that's why they brought me in. But I thought, the image alone of children seeing 50% of their population, their building, that's their community. For a child, this is my community. I live in this one building. This is my neighborhood, right? And 50% of those folks are smoking. That is social norming. That is telling that child, this is normal. This is normal. So the more we can protect our youth from even visualizing smoking, vaping, or marijuana use, it's helping the youth determine right use and wrong use, right? Because we don't want them to pick up that cigarette later because they've just seen it their whole life from their community members using. So make sure we're not exposing our youth to secondhand smoke as well. Next slide. And then what about marijuana? Marijuana rates in Colorado, 26%. Smoking rates, tobacco use, combustible tobacco uses at 14. So what that tells us is more people are smoking marijuana and they're smoking indoors because You can't smoke marijuana outdoors. So this is the group that we can't even say take it outside because they can't take it outside. So this is an issue. But marijuana smoke, that's also a form of indoor air pollution. Marijuana smoke contains the same toxins included in tobacco smoke. So as we clean the air of tobacco smoke and we're getting people off cigarettes, people are using marijuana, so the numbers on marijuana are jumping up, and smoke is smoke. The whole idea is to clear the air. Next. Marijuana use, again, is not allowed in federally funded buildings under the Controlled Substance Act. And then Quality Housing and Work Responsibility Act. I'm going to give you some supplemental language that explains both of these acts, give you more context so you'll understand more how that applies and protects individuals. And next. Okay, let's stop there and take, I'm thinking let's stop there and take a little lunch. Bianca, what do you think? Good?
Yeah, I mean, that's good.
Okay. And then when we get back, we're going to do another workout. We're going to get fit. We're going to do another breakout. Let's do that instead. Let's do Pilates. We're going to do another breakout session. And this time we're going to be creating a strategy to respond to our complaints by discussing them with the housing provider. So we're going to do that when we get back. Don't be scared and not come back now. Breakout rooms are fun. This is how we learn from one another. Okay, so it is 11:40 now. We're going to take 12 minutes. We're going to take 20 minutes, and let's just come back at 12 o'clock. That's 19 minutes for all you math people. The math is math in this time. All right, we look forward to seeing you at noon. Have a good snack, and see you in a few. Take care of yourself. And then a couple people have jumped off because of noon and other work. I appreciate all the time that you guys do give us when you join these trainings. And we are understanding that work continues. So please do what you need to do. But thank you all to everyone who has returned back and is ready to engage in the last hour and a half of our training today. Okay, Bianca. Let's get started where we left off. Slide, let's see, how can we reduce secondhand smoke? All right, so this is the deal, right, guys? How can we reduce or eliminate secondhand smoke exposure? Next slide. I wish there was a simple answer, but here it is, guys, through policies that protect shared breathing spaces. In other words, we've got to figure out some sort of guidelines, enforcement strategy, or policy that can be affected in multi-unit housing in individual spaces to help us through this. Next slide. So again, solution is policy. Next slide. Now, before I move on, I'm gonna just talk about policy for a minute. Municipal ordinance policy, California has it. I think there's about, I don't know, I wouldn't even want to know the number. Pete probably knows. Very few actual municipal ordinances. One that happened when Teddy and I were working over at Public Health Institute was in California. And we saw this kind of like domino effect, right? One policy happened, and then all of a sudden there were 13. And Pete, do you know the number of how many people have policies, smoke-free, like municipal ordinances? You're on mute.
Need to forget that. I mean, it's changed, so I don't know what it is, but there's quite a few municipalities. But it depends on what kind you're looking for. There are ones that have nuisance laws and new construction laws, and so there are many different types as well.
Mm-hmm.
So
I like that, Pete. And so Pete he highlights a really important thing. There are other ways to go about this through policy. There's the nuisance law, or even a rental license that has stipulations within the rental license on how to respond to secondhand smoke, or what the expectation of being smoke-free would be in your rental license. So there are ways to do these policies locally that wouldn't require, it to be added to the Colorado Clean Indoor Air Act, but you could address them locally. So it's important that we have some sort of control over this. But to get back to what I was saying about the municipal ordinances, I think there's about 25. I don't know. I should probably know that number before I speak on it, but I don't. But I was speaking to the person from No Smokers Rights, who did Liz Williams, who did our 7 equitable principles. She's in California. So I talked to her about the municipal ordinance. I was like, that's so great. How did they do that? Because Teddy and I tried to find out, how did you guys do this? And the way that came about was, it was a senior building. So it was a building full of, aging seniors, and they had issues with secondhand smoke, and they were sick, and they were struggling. So they were trying to find out what kind of solutions. And, they came up with a municipal ordinance to protect it, and it was voted on and passed without question, because the story was so compelling, right? Seniors couldn't breathe, their life was impacted, and that happened. The domino effect happened after that one community enacted a small ordinance. Other communities that were connected with that community also created ordinance. So it doesn't have to be really big. It can just be like, how do we stand on secondhand smoke policy, our health department? What are our feelings? The California municipal ordinance, the way they've written the one that they're suggesting is that eviction would not be connected to tenancy, which means that if you break the smoke-free policy, if you violate the smoke-free policy, it would not result in eviction. But that recording is really interesting. I think it really has legs and possibility. So if you haven't seen that, it was in a newsletter several months ago, but I'm happy to send that to you again, and you can view that and even listen to the Q&A from the participants who talk about the pros and cons of enforcing that with a policy instead of by just agreement. So just that side piece there to give you that thing. But what policy outcomes will help us protect is our residents, not just our residents, but the visitors to that property, especially the staff that work within the building. And then even our pets are affected from third-hand smoke, as we've discussed. And results from Colorado studies of comprehensive policies regarding smoke-free communities and properties show that the policy protects pets. It reduces snout and other cancer risk in dogs and cats. Do not diminish this topic. If you are giving a presentation to a building that has pets and they love their pets, and you talk about snout cancer in dogs, it does get their attention. We've had people say, oh my goodness, I didn't even know, poor Fifi is going to die, and now I'm going to quit smoking. So make sure pets are included. Next, Bianca. It offers a significant reduction in exposure and risk related to secondhand smoke to children. So the kids that are crawling around on the floor, the children that are in the unit being exposed, especially kids who have non-smoking parents. Imagine quitting smoking to protect your child and then living in a building that you're continuously exposing your child to secondhand smoke. That it doesn't seem fair. And next. It reduces consumption for people who smoke. So one of the things we found in a study when smoke-free policies were back in 2018, we did a follow-up study to find out smoking patterns of individuals. Some individuals, they had really gone from about 15 people who were 20 people smoking indoors to they went down to 2. So what happens is that if you live in a apartment building, get an elevator, come down, there's a lot to get outside. And then, so you smoke less just by the actual difficulty of smoking, your smoking consumption reduces. And then oftentimes it turns into just quitting altogether, especially when winter rolls around and you just say, I'm not doing this anymore. And then the next image. So again, it supports quitters to commit to stay and quit. I've also led non-smoking groups in buildings of high smoking rates. And when the policy was implemented, they all thought they were going to lose their housing. So they were very desperate to quit smoking to maintain their housing. And then, so I had about 8 people, they were all women, in a smoking class. We were incentivizing them. We gave them $25 for every 4 classes they attended. And all 8 individuals quit smoking. What happened was they stopped enforcing their policy. So they had some legal issues. They didn't implement the policy very well. They didn't have buy-in from the residents. So the smokers actually became very harassing to the non-smokers. And if the non-smokers were even standing outside with the smokers, the folks that had not quit started complaining, well, they're taking your money and they're not quitting. So it became a real social issue within this building with individuals just trying to quit. But what I got from that was, while individuals were equitably supported to quit, given opportunities with cessation opportunities and education and motivation, they were successful. When they became unsuccessful was when the exposure to secondhand smoke became too great for them to, thank you, Pete, I saw that. When the smoke exposure became too big of a trigger for them, they started smoking again. So having a smoke-free place is the best thing you can do to support someone who's trying to quit. And the last image. So, and it encourages youth prevention, like I talked about, social norming. A child who never grows up seeing cigarette smokes rarely picks up a cigarette to smoke. So it's important that we do not let them see that, and we don't live in communities where that is, where we have a high rate of smoking. Next slide, please. So how do we support smoking? How do we support housing providers? This is a big one. Again, we're going to talk about what you have capacity for. All the things I'm talking about, again, recommendations, but it's nice to have agreed upon recommendations, right? Things that we've saw work in the future. So the main thing is, how do we talk to housing providers about establishing a workflow? So many times, if you guys have responded to complaints and talked to housing providers, when you ask them, well, how are you guys enforcing your policy? And they're like, well, we use a 3-step enforcement strategy, 1 warning, blah, blah. They may have 4. We want to make sure that they understand what their expectation is for their policy. So the housing provider has placed an expectation on the resident that their property is smoke-free. The expectation is that they don't smoke in their units. You have to make sure that when a housing provider sets that expectation, that we are supporting them to have that expectation come true, right? So we have to make sure that whatever their expectation is, that we're meeting that with our cessation resources. So if they have like a 0 tolerance policy, then they need to have a ton of cessation opportunities, like the hand-holding kind, where the coach comes in and talks to each individual. So you want to make sure that the housing provider understands expectation is connected to cessation resources. And that's where public health comes in, right? So we look at this, creating a workflow. And this is in a circle because it's not linear. These things can be done over and over, back and forth. The key things is determine documentation. So what's the process the resident has to file a complaint? Does the resident know this process? And is this an anonymous process, or is this a process where they have to, be known? These are all things that's important when they determine what documentation they're going to use to have their residents file their complaint. Then we want to make sure that the staff understands, what do I do when a complaint comes in? Very much like you guys, what do we do when a complaint comes in? We want to establish that process. We want the housing providers to do the same thing, because it keeps consistency Consistency leads to equity. So we want to know who's going to be responsible for responding and documenting this process of the secondhand smoke response. In this section, this is great opportunity to introduce some public health opportunities like trauma-informed care. Here's a good example. I gave a training, a staff training, that we talked about who's going to do that initial knock and talk, right? This building was using the maintenance man, the maintenance worker, to respond. Well, this maintenance worker was about 6'9", and he was a big guy, and he was doing the initial knock and talk, which that's kind of scary. If you have any trauma at all and you're smoking and there's a knock on the door and you're smoking without permission, it's prohibited, that creates this level of trauma. If you do go to the door, then this big scary person is there. That again, so we don't want to re-traumatize people through this process. We want this process to be supported. So who's going to go? Send two people, two really nice people that people like, and knock on the door, people with authority that they trust. So whoever you send, whoever has the role and responsibility of that staff, make sure that they're trained in their role. We also want to make sure that both public health and our housing providers are not over automating. We're so into templates, and I did a public health training. They were like, we got to walk away from these 5 steps and these 4 steps, and let's just talk. But we love to have processes, so there's always steps, but don't over automate it. These as Alberto mentioned, these complaints come in are very nuanced. Sometimes they're kind of like one, but a little bit different. So if we were going to use the same template letter to respond, it's going to lack the content that we need to really reach out to that individual. So it's important that we also share this with our housing providers, because most housing providers, especially market rate, when a complaint comes in, they send an obligatory email to everybody that lives in the property to remind them that they're smoke-free, that they have a smoke-free policy, and smoking is not. So if you're a smoker and you live in a 9-building property and you give that, well, who knows if that's for you or for someone else. If they narrow it down to a specific group of people, so that's why we have those door hangers, which I think are spectacular. I'll show you an image later. If the housing provider went to the floor where the smoking complaint originated from, this is where they think the smoking is coming from. If you went to that floor and you papered the doors with those door hangers, the door hangers say this is a smoke-free policy, that certainly narrows it down to it may be you, right? Because you got a hanger on your door. You're not doing it just to the individual, but you're doing it to the whole floor to say, hey, they're smoking on this floor. So that's got a couple of buildings using those door hangers, and they absolutely love them. So, and finally, we want to help them plan and implement. So we do this by working together, working with your local public health department, working with your public housing authorities, working with your market rate housing, affordable housing, public supportive housing. We want to consider an enforcement protocol that supports quit attempts and prevents eviction. So the key is we don't want you to lose your housing over a smoking violation, but we cannot continue to allow the smoking to occur inside. So there has to be some type of collaborative agreement between housing provider and resident that helps them come to some understanding of, how do I keep my housing? I'm going to try this. I'm going to try to quit. I'm going to try to smoke outside. What can I do to keep my housing? And then that leads us to this kind of restorative justice collaborative conversations through mediation. So we're going to get into that in session 3. How do we do this deep work when it goes beyond us and it's like reasonable accommodation or housing provider contacts deep dive, right? So we're going to go into that in session 3. Again, not an expectation, but a recommendation of what needs to be done. And if any time the capacity of any of this gets too much for you, instead of not letting it be done, please reach out to Ryan and me and see if we can help support you through this, because we certainly don't want anyone falling through the cracks because the local public health department in that jurisdiction doesn't have capacity, because we'll find it. We'll help you through it. I have a phone call today at 2 with a grantee who's doing an interview for the first time, and she asked me if I would, can you join to the conversation. I'm not going to talk. I'm just going to be there, support, and to answer any questions that might happen. I'm happy to do that with any of you as you engage in this process. It's scary and it's confusing, and I want to be there to support you. So if you have an appointment with a grantee or housing provider, a housing provider or resident, and you want me to join, Raya, whatever, Raya's got a little less capacity than I do, but I'm happy to jump on a call and just shadow and help you out. So you're not in this alone. Next slide. Before I go on, I haven't had any questions yet, but there may be a question. Is there anyone have a question on the strategy of the circle of the enforcement protocol for housing providers? Okay. So how do we engage them? So we had a question earlier, like, how do we contact the housing provider? It is hard. It is hard to find them. It is hard to get in contact with them. Don't feel like a failure because your first email was unanswered. But don't let that be your last. Find a new way to reach out to them. And most often, the new way is to find someone above them that has that authority, right? So if you're talking to one property manager, you're reaching out to them and they're not responding, who's their boss? Like, who manages them? If you ever wanted a response and then you're like, oh, if I CC so-and-so, they'll answer me, right? This is the same thing. So you're looking for an opportunity to bring a little bit of authority in there to where they know, like, oh, okay, this person is paying attention, so I need to respond to this public health person. But so how do we engage housing providers? The simple thing are these three things, which are through presentations. I know many of you are out there giving presentations, and I love that. But we want to make sure that we're offering staff engagement. We want to make sure that staff is trained and well suited to do the job they're expected to do. We also want to make sure that we're answering their questions about how does this work, and this isn't going to happen, because you have a lot of that. And then we want to offer as resident education. Sometimes the message is better from an outsider than the property manager. So they might want to bring you in. And when you do resident education, think of an overall concept. Don't just do thinking about quitting. Do like health, maybe your public health nurse wants to go in and talk about health, like healthy habits. Try to do it to where it doesn't look like just smoking, but it's kind of a healthy, how do we live healthy? How do we you need to get creative here and think out the box, because no one wants to come and talk to you about smoking. One or two people maybe, but not the majority. So you want to make sure that your resident education is based on health and improvements, not just quitting your cigarettes. And then another big thing that's just kind of happening, and these are very difficult and the most capacity draining you will ever have, is working with an HOA. We have been doing this and we're building some structure, but it's difficult. So if you Google your complaint and it comes up Zillow, it's probably in an HOA and you have an HOA board. We'll walk you through that. Again, we're going to have one training just on HOA, so you'll understand. And Teddy Montoya from Denver Department of Public Health is joining us on May 14th for our learning community call, which is also based on HOAs. And that should be a start to our education for HOAs. Next slide, please. Oh, some resources we have. We have signage. We have toolkits, that multi-unit housing resource packet, and we have cessation opportunities. I am going to be working with Tiffany to try to narrow down cessation resources that you can deliver when you're having conversations with the housing providers, as well as any updates. One of the resources we have on Tobacco Free Colorado is the Medicaid one pager. So it is the Medicaid benefits. The one pager will tell you what Medicaid will pay, what opportunities they have through their Medicaid benefits for cessation. Now, let me tell you, a lot of these permanent supportive housing settings have classes. One of their classes is how do we use our Medicaid benefits. They have a class just for that. So you want to make sure, I mean, this is even an outreach opportunity that you can do just when you're trying to make relationships, right? Is to reach out to the service coordinator, whoever plans those classes, and say, I see that you have teaching your residents about Medicaid benefits. I'd like to share this one pager with you to talk about cessation benefits individuals have for quitting. We're going to be reviewing that and make sure it's up to date, because I know it was created back in like 2019. But that is a great one pager, just even sent out in emails as a way to kind of meet your housing providers. Next slide. So here are some of the resource materials if you're not familiar with them. Now, the process to get these materials is a little bit on hold right now. We had all of you who had a CoHealth resource login, that's where we were able to obtain the signage. So come to me if you need these resources, and we're gonna, I'm gonna get with Chelsea, and we're gonna really figure out that process as soon as they get a new vendor. I think they're expecting that in the next 3 months. So when we have a new vendor, we'll be able to do that. But the decals are very nice. That metal sign on the bottom there, it comes in both languages, and they're, you know, they have 2 nails, so you hang those outside. We talk about like minimum of 5 signs per property. You want to make sure that the residents understand the expectation that area is smoke free. And those are the door hangs that I was talking about that are really great. It's kind of scary if you see that on your door, but also if you live on that floor and you've complained and you get one of these on your door, you're also going to feel pretty good. You're like, oh, good, they're doing something about it. But like I said, in session 3, we're going to talk more about what expectation the housing provider has to share their process with the individual who's complaining. That's very important. Okay, the next slide, please. Okay, before we get into cessation, we're going to do just quick breakout rooms. We have changed it a little bit because we have broken down to 3. Some folks had lunch meetings and they couldn't come back. So we have 3 breakout rooms now. We're going to take you to a breakout room. I'm going to pop in your room and give you your, thank you, Becky, for letting us know. I'm going to give you your complaint. What we want to do is we want to discuss opportunities for that complaint for a discussion with the housing provider. So we're in the reflect stage. So we're looking at what we have, the complaint, and we're looking at our capacity, and we want to just come up with maybe three options of how we're going to contact and communicate and what we're going to communicate with the housing provider. So that's pretty simple. How are we going to, what's the message? What do we think would support this complaint? And if you did the interview, well, I sort of say we've changed complaints because we changed the room, so that won't work. But let me pop in your room and give you the complaint. I think actually, let's all use the same complaint because I liked that one. So let me put it in the, I'm going to put it in the box, and in the box, in the chat box. Okay. This is the complaint that came in that talked about the manager at Cathedral Plaza smoking. So let's, now in your breakout rooms, please discuss with each other also if you have any confusion of where you are or what you've experienced so far. Talk about that with each other. But the main thing is come back to me, have someone that's going to report out, and we're going to take about 6 minutes. What do you think, Bianca? 6 minutes shouldn't be too hard. Take about 6 minutes to discuss this with one another. What are some possibilities to address this complaint with the housing provider? remember the resident has already complained. They told you, yes, please talk on my behalf. I'm happy for you to share any information that I've given you. And now we're just reaching out to our housing provider. And also tell me, are you going to try to call them? Are you going to email them? How are you going to reach out to them? And maybe who do you think would do that? Okay. Bianca, would you send folks to the breakout rooms? So let's keep in mind, this cessation focused, not cessation required. Next. So this, we want to, right, Angie? Stop emailing me. We want to increase resident access to cessation resources, right? We want to make sure they know where to find them, how to access them, what they cost, what am I going to get for it, everything about cessation. Next. So we want to offer cessation support to those residents who are not ready to quit. So what does this look like? Jefferson County Public Health, Donna Viverette, did a great class, getting ready to quit. So it wasn't like quitting, but what do you do? How do you get ready to quit? Like it talked about cleaning your house, taking your ashtrays, develop a plan, go outside with someone. This in itself is a supportive class for them. So we're not talking about quitting, but we're just talking about how to comply with the expectation, the housing provider expectation. Next. So find out what cessation resources are available. I'm going to go through a few that we offer in Denver, but you need to make sure you're really looking into your community. You know, do you have a doctor or do you have a like Kaiser? Are they teaching any cessation classes? What does your hospitals and your medical facilities around you, what do they offer for cessation opportunities? Is there a nicotine anonymous class in your community or online that you can send folks to? So what is local to you? You need to discover that so you can share that out with the residents and housing provider. And then next. So how do you deliver the message? And we say it all the time. You don't have to quit, but if you want help, we're here, right? So it's also like you don't have to quit smoking to live here. You just can't smoke inside here. And then making sure they understand why. It's because you can't contain the smoke. That towel that you put under your door, it doesn't block the smoke from coming out from under that. The toxins and the gases go straight through it. So the most important thing to remember that we are anti-smoke, not anti-smoker. Big difference. Next. So here's some examples of local resources in Denver County. And I know some of the rural areas don't have these type of resources, but I will go through some national ones. But you may have a hospital that's doing cessation that you don't know about. So with us, we have the Denver Health Tobacco Clinics, and this kind of explains what they get from the Denver Health Tobacco Cessation Clinic. Next. And of course, we have the Colorado Quit Line. I'm good, like I said, working with Tiffany to come up with maybe a one-pager or just find out from her, what would you like to be delivered in these, these meetings with housing providers for support. This is the basic guidelines for the Quit Line. Next. And don't forget this resource for for the mothers and women who are getting ready to give, to have a child and they can't quit smoking. And that's so embarrassing. I've been there. I was pregnant and I could not quit smoking, but then all of a sudden it started making me sick. I started praying about it. I'll just plug that. But all of a sudden it started making me sick. Every time I smoked, I was like, oh, thank God, so I can quit. But there are mothers who don't, and they live in shame and fear because of what they may be doing to their baby that they don't know. So it's really important that we support this demographic. And Baby and Me Tobacco Free is just spectacular. They will come to your housing provider and they will give a presentation on what they do and how they do it. So if you have, buildings where you know there are young mothers and fathers who are raising children. Make sure that they are familiar with baby and me tobacco free. Next slide. So what happens when the process doesn't work? So we're moving into, we'll be moving into session 3, but we're going to go over some common challenges that happen in the work that we're doing, just in the 1, 2, 3 that we're doing right now. This is the biggest one, right? The resident denies smoking is occurring. This happens all the time, and this is the main problem that we have with housing providers. They will say, I went to the unit, they said they weren't smoking. So they're not smoking. So what do? You know, how do you get around this? You're going to have to come up with some sort of process to combat this, because you're going to hear this a lot. The resident is going to deny smoking. So right now we have no testing. We have no real test to determine if it's smoking or not. So this one might really hold you up. And one thing that we say is, it's really kind of, if 3 people are complaining about one smoker, probably smoke happening. One person complaining, it may just be a one-off individual, but it's important to find out how chronic is the exposure, and are more than this one person involved, because that would help kind of cement that there is smoking going on. Even if that individual denied it, someone is smoking because these individuals are being exposed. So another thing that happens is that the resident becomes harassing to community members. So remember earlier in the training, I talked about the individuals that have been getting evicted are more commonly the complainers than the smoker. And that's because they don't know how to complain, and they get so carried away. Thank you, Hazel. They get so carried away with the exposure, they just lose it. And they start yelling and you know, the yelling at their neighbor. You know, can you imagine smelling smoke every night before you go to bed, every single night, getting woken up at 3 in the morning, and the person lives next door to you? How would you feel walking by them in the hallway, right? It would be hard not to say, like, why are you doing this to me? So they get frustrated, and then they get out of control, and then they're the ones that become harassing. Or you have the opposite. Like, the person finds out that you complained about them, and now they are pissed at you, and they're screaming. I've had people send me videos through the door hole, the door peep, where the property manager and the smoker were literally yelling at the door, screaming, we're going to get you out. I mean, it was horrible. So these situations can become quite volatile. So you need to make sure that, you know, we're not creating more problems for this building that already exists. So in this issue with community member against community member, mediation is really a necessity here, because not only do you want the smoking to end, but you want them to live in cohesion with one another, right? You want the community to live comfortably with one another. So this problem may have grown bigger, but a mediation opportunity could benefit this situation, where the owner, the smoker, and the non-smoker and the property manager just have a conversation about, like, what can we do? What can you agree to? How can we make the situation better? Because I think everybody really at the core wants to live in harmony. But these situations do get tricky. Next, Bianca. And then finally, with the housing provider, they just basically say, we don't have any power to enforce that. And you'll hear that too. A housing provider will tell you, listen, we knocked on the door. They said they're not smoking. There's nothing else we can do. So, you know, maybe you get innovative and you find out, like Nikita says, do you have proper signage? Do you have cessation resources? What do you offer your residents who want to quit? Things like that. So always coming from not the problem, but the solution. So always offering the resource solution, the solution, not continuously like fix it, but what opportunities do you as a public health have to suggest to them to make the situation better? Next slide. So what does all this mean for STEP and its partners? Next slide. So remember, no smoke-free ordinance in Colorado provides protections in individual private dwellings of multi-unit housing. So a smoke-free ordinance, no smoke-free ordinance in Colorado provides protection on individual private dwellings. So right now, there's no legal protections. There's a voluntary policy from HUD. I mean, there's a mandatory policy from HUD and voluntary policy from housing providers, but there's no law. So there's nothing that governs what we do. So that's why we're into communication and collaboration. Next. So we do have changes in the law, state law, the Colorado Clean Indoor Act, the updates from 2019, and we have the Surgeon General's report. So it's time to shift our focus, guys, from these individual policies at the multifamily housing facility to these broad, comprehensive smoke-free policies at your local level. So we need to figure out some way locally to have some authority over the situation. This is the updated, the 2019 updates from the Colorado Clean Indoor Act, and that resource can be found on Tobacco Free Colorado as well. Next slide. So how do we do this? We can't do it alone. As you know, our funding gets shorter and shorter, capacity gets more and more drained, and we have more and more difficulties getting our work done. So we have to create strategic partnerships. And you need to figure out either locally or nationally, who can I partner with to help me advance this work that we're doing. First of all, you're partnering with me, a STEP TA, which is great. Partner with a STEP team, which is the POs and the other TA providers. Remember that the cessation piece is 3.1. So if you aren't funded to do work in 2.1, which is multi-unit housing, but you're funded in 3.1, I'm telling you, this demographic is a gold mine for cessation opportunities. So if you're trying to expand your cessation offerings from just your typical quit line to other locations or other settings, I would say that multi-unit housing is the prime example of a setting that's just ready for your engagement. So we need to make sure we're increasing our collaboration between STEP and other CDPHE departments. So think broader, think environmental health teams, think food teams, think bigger than tobacco. We have to infuse our message into theirs. Next, so we want a smoke. So no smoke-free policy. Sorry, I have no idea what that image means, but we'll move on. Oh, I get it. Create a smoke-free policy. So local ordinance, local. You can also do this through licensing. We talked about the rental license. I think there's 3 or 4 of you community grantees, Boulder, Denver, chime up if it's you, that have these residential rental license. I highly suggest you meet peer-to-peer mentoring with one of these counties who has the license or rental license and ask them, how are you doing it? What do you do? What does it say? Because these are opportunities. Fort Collins, they're building a great one. So these are opportunities to put in those stopgap measures to where we can affect secondhand smoke with some authority. If it's in the rental license and you hold the license and that's your expectation, then you're going to follow through. Also, you'll be able to come back to the rental license and contact the housing provider and say, your expectation is this. So looking for other opportunities beyond the big P. Next. Cessation opportunities. Again, cessation opportunities are equal with expectation. Make sure we're offering those. This is where we're coming from. This is our only opportunity to change lives. Next. And then media. What are you doing locally? What are you saying? What's your Facebook page saying about secondhand smoke? I'm going to tell you that when SE2 did their commercials on the patio smokes and the exposure indoors, when they ran those commercials, we could barely handle the complaints that came in. They definitely increased, and it became awareness. So simple messaging on your public health Facebook page are quite effective. Really just explaining, I mean, what I want most people to explain is that in an HOA, you're not protected. Before you buy, you need to make sure of the air. I have people that buy these properties, they smelled smoke when they toured it, and they thought, I can change it once I get there. You will not. It will not be changed by you. So they need to know if you smell it, it's there and it's going to stay there. So I really do want HO people. It's like, I think CDPHE has a really good know before you buy. So they have a really good resource on HOAs and expectation of HOAs. And I can share that with you if you'd like, if I find it. Next image, please. And your environmental health team. But with your environmental health team, you're going to need to be a little bit of an expert, because what environmental health is doing, and it's not a bad thing, is looking at filtration and ventilation. You know, since COVID, they've been tasked, they've discovered, not that you had to discover, we all knew it, there's no indoor air quality. So there is really no standard, there's no process, there is no indoor air quality for multi-unit housing going on in environmental health. Now that COVID happened, they're coming up with ventilation and filtration. Now, both of these are great things. So yes, environmental team, we want you to do that, but we also want you to understand there is no safe level to secondhand smoke. There is no filtration system that's going to clean the air of the toxins and gases. So even though the filters and the ventilation will improve the overall air quality, it does not remove the gases and toxins that are contained in secondhand smoke. So you still would need a policy, and you would still need to prevent people from smoking indoors. But I would say that if someone's being exposed chronically and there seems to be no help from their housing provider to enforce the policy or even create a policy, a filter may be a nice expectation from the housing provider to give that resident for a Band-Aid effect. It will help some. Sometimes it will mentally help the individual if the individual is suffering from environmental toxin sensitivity, where sometimes it's more mental than it is actual exposure. If that makes sense to you. Sometimes a filter will be that placebo effect that they need to know that it's getting better. Again, not a cure, but a stopgap measure that might be the Band-Aid effect. Next image. And then nutrition services. I'm telling you what, the best cessation opportunities are right there in the food banks. So when you are working with your housing provider and you find out, look at their calendar, find out what they do on days. How can I engage tobacco cessation, tobacco smoke-free policy, this health information in with their existing services? Most of them have nutrition services, which is one day where they have food banks. And this is a great opportunity to put a flyer of cessation services, or a flyer to contact or even of like, are you being exposed to secondhand smoke? Whatever you can put in the food boxes, or be there on the day of the food bank to talk about health and improving health through quitting is a great opportunity. Next slide. And more. I love that Pat put there. I'm like, and more. I don't know one more. Okay. So Colorado. Oh, this is Pete's. Okay. So talking about partnership, I am introducing you to your new future partner here, Pete, with the group to alleviate smoking pollution. Most of you already know him. He's going to kind of share with you. Pete, it's 1:13. We're going to leave at 1:30. So I'm going to give you about 8 minutes, whatever you need, to go through and kind of just show folks what they can expect on your website and what type of resources may benefit them.
Hopefully you can see my screen now.
Got it.
Okay, great. So we have several websites, and so there's mysmokefreehousing.org, and on the same website on the left where it says find smoke-free housing goes to mysmokefreehousing.com. So this is the website where you can research what housing is smoke-free based on our internal database. And this is updated at least every 3 months, depending on how many new listings we have to add. If they're less than 50, we might wait 6 months. It all depends on how many more need to be added. But the way it basically works is, and again, it's just those places that we have identified that follow our guidelines. They either have to be 100% smoke-free and follow the HUD guidelines, which it's listed down below, or they can be non-smoke. Yeah.
Can you make that full screen?
Sure.
Thank you.
That better?
Yeah, thank you.
Yeah. So yeah. So the classifications is listed down below. So you can basically, on the top, if you want to search by certain type of housing, you can do that. If you just wanted to find like low income senior housing, could do that. You could search by the city. For example, let's go ahead and look at Brighton. And you could put in a zip code if you want a specific zip code, or you could also search by county. You could search just by those that are smoke-free or those that have what we call a no smoking policy, or you could search and see what's all there. So that's what I'm going to do. And you could just click search. And the way we put together this website is we'll list those that are smoke-free first, and then those that are no smoking last. So you can see when you did this research that it shows 13 properties were found. And if you do the count, the first 3 are the only ones that we identify as being smoke-free. The rest are not. And then you
Would
could always
you
go.
explain real quick the difference between, I know that it was written there, but just a high
Yeah.
level of what's the difference
Yeah,
in non-smoking?
I'll just read it. So, because this is what we have in writing. A smoke-free property does not allow smoking anywhere on the property, including all units, balconies, porches, patios, entrances, and the grounds. And if it follows the HUD rule, which prohibits the use of tobacco products inside all interior and common areas, living units, electrical closets, storage units, administrative offices, and all outdoor areas within 25 feet of the housing and administrative office buildings. So that's pretty much the property. And 25 feet is 20 to 25 feet meets the scientific standard for how far away you should be if you're going to smoke. And then no smoking is the property still doesn't allow smoking indoors anywhere in units, balconies, porches, patios, and the main entrance as required by state or local law. They may also prohibit smoking within a certain distance of their buildings and some outdoor areas, such as a designated area somewhere outside. We will list them as long as they don't allow it anywhere inside or any of those at porches or balconies. For us, if they allow it on a porch or a balcony, they're not smoke-free. The way we want to establish this list was we want to protect people from secondhand smoke as much as possible. And if it's drifting into a building, they're not fully protected. So we may be more stricter than some people, but we want to make sure that people are protected. Does anybody have any questions? Okay. Right.
I just want to clarify with the grantee. So if you are looking and if you saw that list, you saw on the very right side, all the phone numbers, all the website links. So, start here. Just because it's not listed here doesn't mean it's not smoke free. So to go back to Onlee's suggestion, if you're working with a housing provider through a complaint and you went to Pete's My Smoke Free Housing website to research it and it didn't come up, it doesn't mean it's not smoke free or no smoking. It just means they're not on the list. So when you engage that housing provider, what a great opportunity, right? Hey, I'd love to put you on the smoke-free housing website. This is another engagement opportunity. let me connect you with GASP. You should be on the website, right? So if they're not on it, get them on it. And this is a great way also when you need additional information and maybe a phone number that you don't have, or, the website link, it's quick. So I encourage you to reach out to his website as well as him individually.
Yeah, and as I said before, things constantly change, and so you could also contact me and see if we had surveyed them before and found that they weren't smoke-free years ago, or if somebody's complained about them many years ago, we might have that information as well, because also keep information about if they're not smoke-free, why we don't consider them smoke-free. Maybe they allow, smoking behind the building or things like that. So I might already have that information in some cases. So we'll go ahead and go to the other website. And I'm just going to start off with stuff that might be other than the stuff that's really helpful to housing providers, which is the top housing provider resources. If we run into a problem, you could always refer residents to our resident resources section. And if they click on the first link here, it'll give them some tips on things that they could do, where they could go. And then down next to it on more helpful materials, it'll provide them some other resources, such as samples of a letter they could write to a housing provider, or how they should document everything they do, because if they ever file a complaint anywhere, if they can document exactly the steps that they've taken to try to resolve the problem, it could help their case or their complaint. Some other cool things for grantees is if you go to the bottom where it says web links, you'll find all the smoke-free housing programs in the United States. So if you want to see what Arizona is doing or some other community is doing, you could always click on them. While you guys were on asking about that question about how many housing providers how many communities have ordinances, I went through California to see exactly what was going on, and that's where I found that resource. So that's a neat thing to have, and you could look, and if for instance, you can see there's quite a few in a number of states, and if you want to see what they're doing and get some ideas of what they might be doing, something that's different from what we're doing. And then also, if you go down to Health Partner Tools, we have some resources that we built in there for grantees. We have some conference calls that we had many years ago. Some of them were with housing providers, some were with experts. Those might be interesting. A lot of things have changed since then. And under best practices, we have some other tools that might be helpful, like Breaking the Ice with Housing Providers has some tips on how to talk to housing providers. We have down below Health Department to Housing Providers sample letter. This is I don't know how this works on. Yeah, so this will show you a template that you could use to send a letter to a housing provider informing them that you've gotten a complaint. You're welcome. Anything we have on our website, you're welcome to reuse or use compared to or use it your own way is, I guess, the best way. Now I don't know how to go back. Oh, back from this. Hold on. Hold on a second. I have to do this again. So I wasn't able to go back. So hold on a second. That's interesting.
Just don't put us in a breakout room.
How did I do that?
No, I'm just kidding. I'm just kidding.
Okay.
That's good, Pete. We're kind of at time. I wanted them to. Bianca put in the chat box. She found. Thank you. She found I find it incredibly resourceful. Honestly, sometimes I forget what he has in there and then I go back and look at some of the resources. It's like, oh my God, what a genius tool. What a great resource. So please go there. I did notice on some of his resources, he has a request for reasonable accommodation. So that's where we're moving to. Session 3, we're going into the legal aspects and the legal support for residents. Now, no, we don't have to do this, but this is an option. So what we're trying to help you with, our attorney is going to share with you links to help you connect the resident. We're not attorneys, we're not mediators, but we are navigators to these resources. That's what I want you to think of yourself as. I'm a navigator for these resources. So being able to provide the right resource for the resident is more important than solving the issue for them, right? They're going to have to do this on their own and we help them. So that being said, I got 5 minutes left and I'm just going to again put a plug for session 3. It's going to be held by our attorney, Annie Murphy, and our mediators at Find Solution. They're going to be talking about warranty of habitability, reasonable accommodation, and how to connect residents to those resources. This is not something we do on our own, but it's also important to understand that after we've done everything we can do, there are legal recourses because there are individuals who are seriously being affected that have no options. They cannot move. They're living in public housing and they can't move. We have to support them. So how do we do that? We're going to talk about that in session 3. Bianca, would you put the post evaluation in the chat for me, please? So if everyone could complete the evaluation for me, the post evaluation on the training today, we did the pre-evaluation and now this is a post. So it's going to seem like the same questions because it is, with some additional questions. There'll be another email with the evaluation for the folks that hopped off early. So don't do it again, of course, just do that one time. And then when you get the email, just disregard the email. And we'll see if we can't get a good 75% return rate. Let me know what you want to hear in future trainings. I would love to meet with you and help you with anything. There are no stupid questions. I will give you long answers, but there are no stupid questions. So with that being said, I'm going to open it up to any lingering questions or comments or concerns that anyone has before we leave for the day. All right, Guido, I'm going to ask you as the newest employee here. I think you're under that one individual had a week. Did you get anything out of today?
Oh my gosh, yes. I learned a lot about how we can go ahead and improve different processes, different plugs, how we can actually implement maybe hopefully some policies, or even then like, hey, we have this amazing my smoke free housing. Would you love to be a part of it? So yeah, I learned a lot. Huge.
Excellent. And hopefully the breakout rooms gave you guys opportunities to meet one another and learn. Remember, you can always email your fellow STEP grantees, especially those that are down the road further than you, to help you along. So nice seeing all of you today. Enjoy your extra couple minutes. I appreciate your time. We'll see you later.
Thanks, Peggy.
Bye-bye.
Bye.